Good afternoon. My name is Rohan Galbraith, a junior business administration major at Morehouse College, and today I have Dr. Leanna Cart.
Hello.
Hi, Dr. Leanna Cart. So, can you just give us a brief intro about your self and what do you do?
Sure, I'm a chiropractor in private practice for the past 32 years here in Atlanta Metro on the west side. And I have played numerous roles in healthcare, so I'm happy to help you today. And I would like to discuss this from a holistic point of view for the listeners.
Great. Thank you so much. Be able to, so I'm able to interview you today. So, the first question I have is, what is your definition of health economics?
Health economics to me is probably a bit different than what you're studying. Health economics is investing in your health before you get sick. As a chiropractor, I see time and time again people coming to me who are in pain, who have been suffering, who have tried everything and have been unsuccessful in trying to improve their health and get it back on track. So, in my practice, we always stress to people that it's possible that pain brought you to our office, but the bigger underlying message is wellness care. If we were to educate people about wellness care, about taking care of their spine and nervous system first, then I believe that their economics, whether it would be in healthcare or in their personal life or their professional life, would totally improve and change. Because, your nervous system is housed in your spine, and your nervous system is the most important system to take care of. We're just not educated about that here in the United States. So that would be a huge improvement on economics from a holistic point of view, from a medical point of view.
Right, and that goes into my second question. So,
Mm-hmm.
for those who are not aware, can you, well, you already did, but go into depth about and describe our healthcare system here in the United States compared to, say, Canada or Europe?
Sure. Uh, Again, as a chiropractor, I see people that are looking for an alternative to the drugs, to the surgery. We have a huge crisis going on in the United States, and particularly in Georgia. 135 people daily are dying of opioid prescriptions that were prescribed to them in good faith. And it's just a matter of getting the message out there on what are the alternatives to changing people's lives. I don't particularly think that health comes in a bottle or comes from a pill or a potion. So it's about changing the mindset on how can we improve our health care. And I think taking the patient and educating them on alternatives like chiropractic, like acupuncture, like massage, like physical therapy, nutrition. If we could teach people to eat right, we could probably get half of the people off their insulin, just as an example. That being said, that's not what our system is designed for. Our system is a sick healthcare system that's designed to treat crises and disease. What I'm talking about is treating wellness, treating people before things happen, and explaining and educating them as to why that should be done. Now, I know in Canada and in Europe, they have a national system, and having dual nationality and having experienced a family member having a brain surgery in Europe in that system and looking at the bill, I could not believe the low cost. Now, of course, the citizens pay for that on their taxes, but it does seem a bit more equal than what we have in the United States, which is, the people that can pay get the better service. And that's really not what saving lives is all about, in
Right.
my mind.
Right. So, do you believe that everyone should be afforded health care?
Yes, yes.
I agree.
And chiropractic is very affordable. Most of our patients don't even use their health insurance because the office fee is so low
Right.
that people just pay for it out of their pocket. And those that we've been fortunate enough to educate about having a monthly wellness, like you would have the oil change on your car so that it performs as best as it could, or your teeth checked, or your eyes checked. I know that those patients that come monthly understand the value of taking care of their nervous system before something happens, because on a daily basis we have all these stresses throwing at us, emotionally, physically. Sitting is the new
Right.
dangerous problem. People are sitting at computers all day, students are looking at iPhones. All of these things affect the function of your nervous system, which ultimately controls and coordinates every single part of us.
Right. So, what areas in the healthcare system do you believe needs room for improvement?
Well, definitely, I believe that wellness should be put to the front of the line. When patients, like, for example, a diabetic person should be taught how to eat right, should be taught how to stretch, should be taught about massage, should be taught about acupuncture. I think we need to take a better overall view of how patients are being treated. In this allopathic system, and I'm not speaking from a negative point of view, just from 32 years of watching the types of people that enter our office. It's as if you go to the doctor, you have this pain, and that's the part they look at. What I'm talking about is looking at the patient as a whole, seeing how can we improve their life without drugs or surgery first, and use that as the last resort. I think that would not only improve the patient's life, but it would improve the economics of less insurance claims, less surgeries. And this opioid crisis is a prime example of what happens when people enter a doctor's office with good intent to get out of pain, get these prescriptions, because possibly their copay is lower to see their primary care provider versus, let's say, a chiropractor who's under a specialty copay of double the price.
Right.
And, you can't let price be your driver when it comes to improving health. And that's unfortunately what many of the policies have become in Georgia.
Yep, I definitely agree. So, digging deeper into our healthcare system, what demographic do you think holds the most uninsured people?
Oh, by far, minorities. By far. I know in my Hispanic community and the African American community, very uninsured, very uneducated about nutrition, about proper balance in diet, about massage. Now, I will say that chiropractic is a very integral part of those communities because it's affordable, it's safe, and to some degree, it's cultural. Hispanics believe very, very, very strongly in holistic procedures. So I've been very fortunate to be able to help a lot of the members of my own community, as well as the African American community on that, but definitely underinsured. And so the underinsured, look for affordable alternatives to improve their health.
I definitely agree. I feel like if they were more educated, being taught maybe in like the school system and was more so focused on it, if they were focused on that, then prior to other things, we'll probably get more.
Yes.
So what would you say contributes to so many people in that demographic being uninsured? Like, as education, like we just said,
Yeah.
is one of the factors.
I think that education's a key. I also feel that oftentimes it is economic, that the prices are so outrageous that it's crazy. I mean, luckily President Obama did something about it to help, but we still need to get more done.
I agree. So, what roles do insurance companies play in availability and affordability of healthcare?
Well, I don't know if they really are in it for the same reason, because remember, all insurance companies are traded on the stock exchange for profits.
Right.
So, that being said, I'm leery of things that are for profit when it comes to saving lives. Yes, thankfully, President Obama took out of that law about pre-existing conditions, so that helped many people that had been punished because they had previous diseases. So that's a little bit better, but I do believe there's more work to be done in seeing the overall picture. In a perfect world for me, it would be chiropractors being the primary gatekeepers that were qualified to know that things that could be treated with chiropractic, massage, acupuncture, occupational therapy, physical therapy, and then moving on to something more aggressive. That would be like the perfect fantasy world for me. And I think that would benefit the African American and Hispanic community. But we have a ways to go for that, because remember, this is all about financial gain.
Yeah, definitely financial gain. So, do hospitals have a role in developing a more affordable and sustainable healthcare system? If so, describe it.
I know that there are hospitals around the country that have chiropractic departments in it.
Oh, really?
Yeah,
I didn't know that.
and they've been very financially successful. And I do know that now even the military is offering chiropractic care to the veterans that are waiting months to be seen. We've been part of that program now, and it's actually been great. I'd like to see more hospitals do more wellness. I mean, wellness in the allopathic world is defined as getting your mammogram and getting your colonoscopy, but it needs to go further than that. It would be wonderful to have meditation, massage put into a hospital where even if a patient needed surgery or needed medication, that it was incorporated into some of these other philosophies that have been around for thousands of years.
I agree.
Yeah.
So, what role do physicians have in developing more affordable and sustainable healthcare options?
Many physicians now, unlike chiropractors, are employees of the hospitals who seem to be buying all these private practices and incorporating them so they become these huge companies. And I have lots of friends that are medical providers that remember a time when they were also in private practice like most chiropractors, and they feel it, even though yes, for them personally it might be a better salary than being a small business owner, steady income, but they feel the crunch, that there's doctor-patient relationships that are different than they used to be. Many of the carriers, and even in chiropractic, if people file some of their insurance, they have these gatekeepers that want you and require you to do so much paperwork, and the patients are afraid to tell you all of where they've been, for it might not get covered. Things like that need to be taken out.
And what role do you think pharmaceutical companies have in developing more affordable and sustainable healthcare options?
Well, the big pharma is the problem. They control. It's $1 billion industry, and just look at television every night. See who the big players are on TV. Nothing that's really good for you. You know, they show pretty people of all different ages
What's the advertisement?
advertising all kinds of medications, and it's subliminal brainwashing to make the general public of this country think it's okay to take drugs to get your health, and that is not a scientific solution or a socioeconomic solution. It's a billion-dollar industry, and I think if they were to regulate big pharma more, then you would see things change. I mean, they are one of the biggest lobbying groups in Washington, and there's a lot of play between big pharma and FDA. That needs to all change, in the perfect world, to really get underneath. You're going to tell me somebody who's suffering from cancer has to take, for example, these pills each month. I have patients telling me it costs $10,000 to $15,000 a pill, and then, they won't have their life if they don't get that pill. Doesn't sound normal to me that it takes that much money to make that pill. That's an issue.
Definitely agree. This is my last question.
Am I giving you good information?
No, you're giving me a lot.
Are you sure?
Actually, learning so much that I didn't even know. So my last question is, what are the pros and cons of the government subsidizing healthcare for Americans?
Well, right now, the government subsidizes some of the health care in Medicaid. And there are some states that have chiropractic that are included. Unfortunately, Georgia's not one of them. I think one of the good things for that is that you give people who are not in a fortunate place options,
Right.
better options that don't cost as much, to improve their lives of themselves and their families. Because when people don't have hope, they don't see any way to get out of the situations they're in when they don't have their health. So it's like a vicious cycle almost. Now, if the government really wanted to change it, I think they could. But again, there's a lot of money involved in that, and very few people get that money. But it affects everybody's life on their decisions, So I think that it would be nice for people to protest,
Definitely. Well, thank you so much, Dr. Cart, for allowing me to interview you today. I really enjoyed and was very educated on just the chiropractic field and just more about the healthcare field.
Well, I appreciate you coming. It's always nice to talk to people that are young, that have the opportunity to possibly make change. You can be a world changer.
Definitely, especially being educated on this type of topic. Thank you so much.